This Saturday will mark the one-year anniversary of the controversial Supreme Court decision to overturn Roe v. Wade. That ruling effectively banned abortion in Wisconsin, leading many to travel outside the state to receive care.
State leaders have scrambled since to put support services in place to work around Wisconsin's 1849 law. Tahlil Mohideen joins us to share more about a proposal to get students and providers access to abortion training.
Medical program leaders in the state are worried about how the state's abortion ban could impact recruitment and retention efforts, especially as they deal with a physician shortage. They're looking to partnerships with centers out of state for more comprehensive training, but that too comes with limitations. For a long time, Sammy Strobel has looked forward to going to medical school at UW.
To be able to, use this position that I'll have to advocate for other people.
More specifically, she wants to be an OBGYN. So when the news broke of the Supreme Court decision to overturn Roe v. Wade, she worried about what that would mean for her education.
It did scare me a little bit a few weeks before starting school, knowing that starting a career in becoming an OBGYN is something that I've always wanted.
She says medical students, residents, and schools alike are finding themselves in a tricky situation.
For one, a lot of the residents, the OB residents that are currently getting their education in Wisconsin are heading to areas like Rockford, places in Illinois where they're able to get that training.
But for many Wisconsin students wanting to get abortion education before they receive their medical degree, their options are more limited. It's the reason Senator Tammy Baldwin introduced the Reproductive Healthcare Training Act in mid-June to help support training in abortion care. In a press release, she said the proposal would ease the burden that out-of-state training brings and support programs bearing the weight of it.
I think it would be a huge change and a huge motivator.
Hands-on abortion training is not required to get a medical degree, but medical programs are required to offer it to people who want to become board-certified OBGYNs. To work around this, UW Health, for example, has created a partnership with the University of Chicago to provide OB residents a rotation in Illinois. The Reproductive Healthcare Act would dedicate $25 million a year for the next 5 years in grants to eligible medical programs.
Meanwhile, most OBGYNs are worried about the effects of revoking the federal right to an abortion. That's according to a new survey by the Kaiser Family Foundation. The organization surveyed hundreds of practicing OBGYNs nationwide about their experiences since the Supreme Court's decision last year. More than 2/3 said the ruling has worsened their ability to respond to pregnancy-related emergencies and exacerbated pregnancy-related mortality. About a quarter of OBGYNs said they had patients who could not get an abortion they wanted. Half of those were in states where abortion is banned.